We get cases of measles, but we haven't had a death in 10 years, and we just did. There's an outbreak in Texas. What's an outbreak? 20 are still hospitalized with measles. Is that extraordinary? Yes. Is it without precedent? No. In the cabinet meeting today, President Trump was asked about it, and he turned to Bobby Kennedy Jr. Here's what the new secretary for HHS said.
We are following the measles epidemic every day. I think there's 124 people who have contracted measles at this point in Gaines County, Texas. Mainly, we're told, in the Mennonite community. There are 2 people who have died. There have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
Is that a fair assessment? Is this one different? Okay. Now, remember, in context, the outbreaks come after measles was declared eliminated from the U.S. in 2000. In recent years, we've seen a spike in cases since the vaccine hesitancy movement has grown. And let's be honest, Bobby Kennedy Jr. helped fuel that. Now, is there a cause for concern in these numbers? Let's ask Deborah Birx, the doctor who helped coordinate the U.S. COVID response. Good to see you again, Doc.
Good to see you.
So tell me what I need to know.
So this is a pretty unique situation right now. With the measles outbreaks we've had in 2023 and early 2024, we're often in communities of people who've come foreign-born, and yes, vaccine hesitancy played a role, but in these communities, these are extreme rural communities. It's why I'm dedicated now to really working on rural healthcare. They don't really have access to healthcare in these rural communities. And this particular community had religious objections to vaccination. We've always had specific communities that have had religious objection to vaccination. And because the rest of our children are immunized, they really form a buffer around those communities, so they really don't get exposed to measles because we don't have widespread measles. What worries me is what we're seeing today are people who got infected, children who got infected almost 2 weeks ago. This is a high number of hospitalizations. To lose a child, I just feel for the family. You know, once you're a mom, you just would feel for any mom who had to go through this. No one wants their child to die from a preventable vaccinating disease. For those of us who grew up so long ago, remember, we didn't have access to MMRs. So we had deadly infectious diseases that took our friends. But now today, we shouldn't have that be happening.
But doesn't the word Mennonite explain the whole situation? I mean, it's not that it's COVID-19 hysteria that, you know, Bobby was a part of. This is the Mennonites don't take the vaccine. That's the end of the analysis.
So this particular community, yes, but because vaccine hesitancy, and let's be very clear, vaccine hesitancy has risen most since COVID. We had it at baseline, ticking up tiny amounts. But ever since COVID, we had the most dramatic inflection point in vaccine hesitancy, and it's building every year. And so we have to take this very seriously. And I think we have to get into communities and talk to people. When I talk to you about them not having access to healthcare, we talk about maternal deserts. Well, these are pediatrician deserts. These are family practice deserts. These are places where they don't have access to community health nurses. So we have to do a better job as public health in really getting into communities and talking to people and talking to them about what vaccines do, and then talking to the rest of the community to understand why it's important that their children are immunized, because we've always had children that either didn't develop a good immune response to a vaccine and are susceptible to measles, like children that have gotten cancer therapy or immunosuppressed children. And our children really form a protective group around them. And we really want to protect our American children. So I think there is a way forward, but we have to spend a lot more time talking to people at the community level, understanding their concerns, and really work at improving vaccination levels. And I really want to thank the nurses and doctors out there that are taking care of these young children. Many of these physicians hadn't seen measles or really sick kids with measles ever in their training. So that shows you how rare it is.
Dr. Birx, I appreciate the perspective. When you want to come on and talk about what's happening, in the ex-urban and rural areas and what needs to be addressed. You got a platform for it right here on NewsNation.
Thank you.
Take care, and it's good to see you. Hey, thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget, click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.